Wonderful. I'm going to ask you a question. I was just thinking of that. Um, for dental implants, doesn't your medical history play a part in whether you're a good candidate for implants?
Great question. What Lynn is asking is whether your medical history plays a part in your treatment, whether you are a good candidate for a dental implant or not. So, just before walking in here, I saw a patient this morning in my office. This patient has gone through radiation and chemotherapy, and that too, they had gone through the chemotherapy and the radiation very recently because of a throat cancer. So that patient is going to need a tooth extraction, but the tooth extraction is not immediate, meaning it can wait. So what I told them is, you are not a good candidate for even an extraction. They have multiple missing teeth in their mouth, and I told them, you are not even a candidate for extraction. Forget about dental implant. So this is one of the examples. Chemotherapy or radiation is one of the examples patients cannot receive dental implant. One other contraindication is patients who are receiving medication for osteoporosis. Many women are suffering osteoporosis. Many of you guys watching tonight may be receiving some medications or treatment for osteoporosis, and you may not be a good candidate for a dental implant. I'm not making a blanket statement. If you have osteoporosis or osteopenia, you are not a good candidate. Many people, depending on the severity of the osteoporosis or the severity of the medical condition, they may not be a good candidate. Even patients who had cancer treatment or they had a chemotherapy or a radiation, we can still make them a candidate. But these are some of the most common contraindications for dental implant, and depending on wherever they are in their journey of recovery, we can make them a candidate for dental implants.
And along with that, patients that smoke that's a contraindication for dental implants as well, for the longevity of them, isn't it?
So great question. What Lynn is asking is smoking a contraindication? So there is a difference between contraindication means you cannot absolutely receive a dental implant, as opposed to you are a high risk candidate. So for those patients who are who are smoking, they are a little bit higher risk candidate for dental implant as opposed to somebody who is not smoking. For somebody who had cancer, that's a different story. That's a contraindication. They cannot receive the dental implant at all for a certain period of time, period. But for somebody who is smoking, we do implants all the time, but we tell them, and I do have an obligation to tell them, hey, relative and compared to somebody who is not smoking, you are slightly at a higher risk, or somebody who is smoking 2 packs a day and they are even at a higher risk of losing those dental implants or having some complication following. So again, great question. For somebody who is a smoker, they may not, it's not that the implants are contraindicated, but depending on how much they smoke, they may be at a higher risk of receiving those dental implants. Yeah.
Wonderful.
Yeah.
We're out of time.
All right. Thank you, everybody, and thank you for joining us for another episode. And we look forward to seeing you the next time. Thank you so much.
Thank you so much.